অত বেশি নাই।
হুম।
রেকর্ডিংটা অফ করেন।
প্রথমে কি ওয়ারফারিন সিনারি
সিনারিটা কি দেখা যাচ্ছে?
না, সিনারিও দেখা যাচ্ছে না।
দেখা যাচ্ছে না। Share. Screen. এখন দেখা যাচ্ছে?
ইয়েস।
ওকে। সো আমি তাহলে শুরু করতেছি ওয়েলকাম দিয়ে। এটা কি রেকর্ডিং শুরু হয়েছে? Okay. Welcome you all to Genesis Outlier MRCS program. Today we are organizing Part B mock session on a communication station with a patient. Just to make you guys understand how the real life scenario will be in the examination center and how you should actually approach whatever you are presented with. I am Dr. Fatima Imroz Nisha, and today I have with me Dr. Nahida Nipa Apu from Phase B, Burn and Plastic Surgery. আপু আমরা শুরু করতেছি তাহলে।
Yes, yes.
Okay. So your candidate instructions should be, you are asked to talk to the 58-year-old anxious male who has presented with recurrent inguinal hernia in your surgical outdoor. He is legally blind due to the cataracts and is on warfarin as he has undergone mechanical heart valve replacement. He has come as he is not sure about the warfarin and is concerned about his operation. Considering this communication skill station, counsel this patient about the need of stopping warfarin for hernia operation. Dr. Nipa, you will get 1 minute to think over it and then we'll start.
Yes, okay. Thank you. There is no patient's name here. Can I confirm patient's name?
The patient's name is Mr. Jack.
Okay, thank you.
Let me know if you are ready.
Okay. Okay. Can we start?
Are you ready?
Yes.
Okay. So you
Let
will
me
get
on the
9
stopwatch.
minutes. Yeah. You will get 9 minutes to complete this station. So you have all the time you need with your patient.
Okay. Thank you. Hello. Good morning. It's Dr. Nahida here. Can I tap over your shoulder? That's why you can locate me.
Yes, sure.
Oh, okay. Thank you. Thank you, Mr. Jack. This is Dr. Nahida here, one of surgical doctor today. So how are you doing today, Mr. Jack?
Yes, doctor, I'm not feeling so much fine. I
Uh,
actually have replaced a valve in my heart, and for that, I am taking warfarin right now. And my
I understand.
cardiologist said that if I stop this, I may
Yes.
die.
Oh, I appreciate your concern, Mr. Jack. I understand how are you feeling right now. So please, you have some issue with your stopping your warfarin. So please, can you tell me more about what do you know about warfarin?
I don't know much. I just know that this is keeping me alive.
Okay, I understand your concern, Mr. Jack. So please, let me explain it to you, Mr. Jack. You have an mechanical heart valve replacement, and now you have recurrent inguinal hernia, and you are going to have an surgery for this problem. And you are getting warfarin as because you have heart valve replacement, and your doctor has prescribed you warfarin that will prevent blood clot over your mechanical valve. Am I right? Can you understand me?
Yes, yes.
Okay. Okay, so now you have some issues because you don't want to stop the warfarin. Your doctor told you to stop it. Am I right?
Yes, I'm actually worried about that. Why would he tell me to stop it if it's threatening to life?
Okay, okay. Of course, I appreciate your concern, Mr. Jack. So, you are going to have an operation. You already concerned about that. You are going to have an hernia operation. So, and you are already having warfarin. Warfarin is given to our patient for thinning the blood. So as you are going to operation, you will have some bleeding during the operation, and if you don't
Oh my
stop the
God, doctor, am I going to die?
I appreciate your concern, and we are concerned about all about the procedure of the procedure of the operation. You can rely on us, and we will try our best to control the bleeding. And that's why if we don't stop warfarin, it will be a problem for us as well as you to stop the bleeding during operation and after operation. Can you understand me?
But my cardiologist said if I stop warfarin, I may die. What are you
Uh,
doing for that?
I understand your condition, Mr. Jack. Please let me explain. Please don't worry. We don't leave you without any protection. As you are getting warfarin for its blood thinning property, so don't worry. We will give you another blood thinning medication that is heparin, that is injectable, and the difference between warfarin and heparin is both are equally blood thinning medication, but warfarin has long duration of action. That's why we have to stop it 5 days before the operation, and we will start heparin for you, and it has a short duration of action. That's why we can stop the warfarin just before 2 hour 12 hour before the operation. Can you understand me?
Yeah, I understand you, but can't you talk to my cardiologist and sort out this thing? I can't
Of
really stop
course.
warfarin.
Of course, I appreciate your concern, Mr. Jack. Of course, we will consult you with your cardiologist about your concern, and we are very much concerned about your apprehensions.
So when are you going to resume my warfarin?
Okay, we will resume warfarin after operation, and we will do a blood test that is INR, and we will look for the INR. If it is within normal range, we will start the warfarin as early as possible.
I'm not actually confident on whatever you just said. I only trust my cardiologist. I really don't trust you right now.
I appreciate your concern, Mr. Jack. Of course, you can consult with your cardiologist, and we will arrange a meeting with your cardiologist. And before operation, you can talk to your cardiologist.
Okay, thank you so much. That will be very helpful. But can you tell me about the necessity of staying in hospital prior to operation? Because, I'm not so comfortable staying in hospital.
I understand your condition, Mr. Jack, and I appreciate you. Of course, for injecting heparin, you don't need to stay in hospital, and we usually don't uh, suggest our patient to stay in the hospital. You can stay at home, and you and our patient we learn it our patient how to inject heparin at home. And usually if anyone is older age patient or have dementia, they can take help from district nurse. And if you have an issue like that, then we will arrange it.
But, doctor, I'm really worried. I think I will die if I stop this heparin. I have survived valve replacement already. I'm feeling like I'm gonna die on operation bed if you just stop my heparin.
I can appreciate you, but I can ensure you are in best hand, and we will take care of you in every possible way, and you will be better treated by us, our team. Are you understanding me?
Yes, doctor. I also take my anti-anxiety medication. So, what do you want to say about that,
Oh,
doctor?
you, of course, you can continue it. It will not a big deal. It's not a big deal. You can continue it. No
But
problem.
doctor, you are not making me understand why heparin and why warfarin. I don't like heparin. And if it was that much better, my cardiologist would have given me heparin. Why didn't he?
I understand. As heparin, I want to mention you again that heparin is injectable and warfarin is a oral medication. And I hope you don't like to take injection every day. That's why your cardiologist give you warfarin. But the problem is warfarin has long duration of action. We have to stop it before 5 days. The duration of it, do you understand what is duration of action? Can I explain it?
No, doctor. Can you please explain?
Oh, okay. So when we take a medication, it eliminated from our body after a certain time. The difference between heparin and warfarin is warfarin take a longer time. It is 5 day, 5 day to excrete or eliminate from our body. So that's why we have to stop it 5 days before. And if we give heparin, heparin will eliminate from your body by 12 hour, and we can stop it just before your operation. Can you understand me right now?
Yes, doctor. I guess you are right.
Do you have anything else? Do you want to add anything else or ask anything?
Can I have your number, doctor, so
Of
that
course, of
if
course.
any question comes, I can ring you up?
Yes, of course. I will leave my number in nurse station. You can contact with me anytime.
Thank you, doctor. You are much helpful to me.
Okay. Thank you so much. So can I summarize our conversation right now?
Yeah, sure.
Okay. Mr. Jack, you have already gone mechanical hardware replacement, and now you are on warfarin, and you have recurrent inguinal hernia, and you are going to surgery for this condition, and you had some issue with stopping the warfarin medication and starting your heparin. Right now you are understanding the conditions, and you have no problem or no issue right now with starting heparin and stopping warfarin. Am I
Thank
right?
you.
Okay.
Yes.
Okay.
Uh,
Thank you so much.
Okay, Apu. You were 40-second extra though,
Okay.
but I guess that's okay. I didn't stop you because this is a recorded version. And
Yes.
it's good if you can summarize, but it's not mandatory to summarize all the time. If
Yes.
you like this, if the situation demands, you can also let it go if
Okay.
it's not within the time. But the way you handle the patient and the way you reply to some question which is not in the existing textbook right now, that is commendable. um, I would like to suggest few things for you, as like you can tell like if the patient is understanding whatever you are saying, you can just make some variation by asking three, four same kind of things, not just one thing throughout the whole 9 minutes, because you will only
Okay.
get one communication station with the patient. All right. Okay,
Okay.
let me stop the share. Okay. So you can tell them, do you understand me? You can tell them, does that sound clear to you? You can
Okay.
tell them, is it okay with you? You can tell them, are you getting me? Okay. So through this way, you can make all the variations, and that will keep the conversation interesting and it will keep the conversation going. Because the patient may
Okay.
also get bothered if you tell the same thing again and again. Okay.
Okay.
And
Okay.
also, you have to say some phrases like, I understand you, I'm hearing you, I'm listening to you, don't worry. This kind of thing really reflects that you are very empathetic towards the patient and you understand the whole scenario from patient's point of view. Because in communication station, there will be a layman examiner who will mark you over your professionalism, over your empathy, and how well you say all the medical jargons in layman terms. Okay, so this is very important in terms of your exam. So prepare in that way. All right. Otherwise, you have touched all of the things. And please, at first, when you are introducing to the patient, tell him why you are here today. Is that all right?
Okay. Yes, thank you. Thank you so much, Nisha. So,
Okay.
on 6th December, we are going to have a mock in RCS style, and you and other mentor panel are working on it. So, can we have some words regarding your preparation or about the mock? How are you preparing, or how our candidates should prepare themselves for the mock?
Okay. As far I know, this is the first time, I think, in the whole world that we are doing this RCS style mock. Because what I felt from my preparation time is that I had to go through a hands-on course just 3 to 4 days before my exam, and I didn't have any time to prepare for the skill station the way I wanted to prepare myself, like giving a mock exam. The way we can give mock for knowledge part, some of the history part in over online, but it's really helpful if you give the skill part in a mock station before your exam, because you will know what you lack. Rather than understanding what you lack in the exam center, it's better to know that beforehand and work on it and ace the exam, right?
Yes.
So we are actually preparing the knowledge and skill station separately. We are doing all the marking criterias. We are making it at a sheet, and these sheets will be available to all the mock examiner, and the examinees will give the exam just as the main exam. They will all have 10 minutes each for each of the station. And after knowledge circuit, there will be a half an hour break, and we will again conduct the same thing in the skill station. And the participants will get 10 minutes each for all the skill for every skill station. And there will be there will be dummies for procedural skills. There will be patients, real life patients, on whom you have to do the examination, from whom you can take the history, and all those, like in communication station, there will be real life patients, so that our participant doesn't get scared in the examination center. And they will also get the feedback after their exam and how they can improve themselves after the whole exam. And we will also help them if they want to practice whatever they lack in knowledge or skill station. And we will, according to the demand, we will also can like conduct feedback session later after the mock exam. I think this will be very helpful for the examinees who are giving this part B exam twice. And this is very helpful for the new, because they will get the first-hand experience, how it feels like to give an exam in an international center, and how you should dress, you should be prepared for that. Okay, because this is, you can't really experience anywhere other than exam center. So if you can practice that beforehand, I am sure you will feel less scared for the main exam, and you will think that this environment is very familiar to me, and you will feel at ease while giving the actual exam. So I believe this will be very helpful for the candidates. Apu, you have to unmute yourself.
Okay, thank you. Sorry. Thank you, Fatima Imroz Nisha, for today's session. And I hadn't practiced. As you first told me, and I just thinking I have to grab the opportunity to do this. I will never. It will never happen. Going to be happening that I am this type of opportunity. Thank you so much. We can arrange more and more mock. If you are interested to join our mock, you can inbox us. We can arrange another free mock for you uh, through online and offline. We are coming on 6th December 2024. Thank you, Nisha. Thank you so much for your participation.
Thank you,
Inshallah, we
Apu.
will arrange more and more mocks.
Okay. Thank you so
Okay.
much.
Assalamu alaikum.